We believe we're going to be out of this this spring or in the summer.
50 more COVID-19 cases in Alberta and 3 more deaths, all in Calgary, including one at the Mackenzie Town Continuing Care Centre. Premier Jason Kenney releases the latest numbers and breaks down the modeling of what could be 800,000 confirmed and presumptive cases before the end of the summer. The data also notes between 400 and 3,100 deaths.
Some of those wide variations in numbers are really because, again, it all depends on us. So it depends how successful we are in preventing spread, particularly how successful we are in protecting those who are the most vulnerable to severe outcomes. And so I think to Albertans, I would say, again, that this is in our hands.
That's the most probable case, but there is also an elevated scenario with over 1 million cases. Kenney says he's looking at countries using check-in tools and other measures to restart their economies. Because for a complete lockdown,
the economic damage would be incalculable. Or we can take a more targeted approach, like those countries have done so smartly, by limiting the risk.
The province plans to add more than 2,200 acute care beds and over 1,000 ICU beds and make 761 ventilators available, all before the end of the month. Testing is also expanding to anyone with a cough, fever, runny nose, sore throat, or shortness of breath, and are living in the Calgary zone or living with a person over 65, or if they're an essential worker. Kenney says more masks, scrubs, and other protective gear is arriving, but the Premier says he's not satisfied with border services at airports, noting BC and Ontario's first cases came from international travelers.
I think it was irresponsible to let it happen that way. And I join NDP Premier John Horgan in saying, if the federal government will not properly protect our borders, we will.
Dr. Hinshaw says there would have to be at least 2 weeks of cases dropping to consider loosening public health measures. In Calgary, Crystal Adaris, City News.